Hi, my name is Crystal Wilson, and I will be discussing Saintemarie University Hospital case study. The healthcare industry. This case revolves around the healthcare industry, so I will begin by explaining the overall challenges in the industry. Currently, there is a shortage of nurses and has been for some time. Also, there is predicted to be a shortage of physicians in the next coming years. This is mainly due to the increase in demand for healthcare. Healthcare demands have increased because of the growing and aging population. All of these factors combined lead to overcrowding and congestion in the hospital, especially the emergency department. Saintemarie University Hospital. The hospital serves a mid-sized European town with a population of 512,000. The hospital is the only place that provides all ranges of care for every type of patient. The next closest hospital is 50 miles away, and patients are sent by helicopter when needed. This is extremely expensive. The hospital is the only place equipped to handle emergencies within the town. The emergency department. The ER consists of 250 staff members and 40 examination rooms. On average, there are 165 patients who come into the ER every day. It can be reported by patients. It has been reported by patients that the ER waits are entirely too long. On average, 5 patients leave the ER without being seen due to the long waits. The State Secretary of Health has reached out to the hospital and has demanded an action plan and measurable progress by the end of the month. Stages to patients' ER visits. The initial stage includes a preliminary exam about 3 minutes, registration about 10 minutes, but the average wait time is an hour and 10 minutes, but can go as high as 10 hours. For patient management, the average is 3 hours and 10 minutes, but can be more than 10 hours for complex cases. For patient discharge, the average time in this stage is 40 minutes. From registration to discharge, the average person spends 5 hours in the emergency room. Reasons for the wait. Currently, the staff is scheduled into 2 shifts, from 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. The heaviest amount of traffic seen by the hospital is 9 a.m. to 7 p.m., with a peak around 11 a.m. Solution: hire new staff with a shift from 9 a.m. to 5 p.m. or 10 a.m. to 6 p.m., which can help alleviate pressure from the current staff. Laboratory test results. Currently, the ER department uses a centralized laboratory that is used by the whole hospital. On average, it takes 2 hours for tests to be processed. A solution can be that a select number of people who work in the laboratory only process ER results. This can help cut back on time for the emergency department. CAT scan process. Currently, there is only one CT scanner for the ER. On average, it takes 30 minutes to run a CT scan. Due to the inefficient process of transporting one patient from the CT scanner room and bringing in a new patient, the CT scanner goes unused for 10 minutes between each patient. That time adds up throughout the day and is one of the reasons it takes on average 3 hours for doctors to receive the results once they have ordered the test. A solution: the CT scanner staff should call in the nurse to retrieve the patient about 10 minutes before the test is concluded instead of when the test is over. This will allow the nurse to have some time to get to the CT room. Also, the CT scanner staff should call the nurse who is bringing in the next patient when the nurse arrives to retrieve the original patient. This will cut down on unused time for the CT scanner. inefficient ways to review patient results. It takes about 45 minutes from when test results come in to a decision being made for the next step in patient's care. One of the reasons is because interns want to run their opinion by their supervisor before going to speak with the patient. A solution could be having the intern and supervisor review the test together from the beginning. This can help cut back on time. Also, ER staff treats patient beyond stabilization. The mission of the ER is to make sure a patient is stable and has been diagnosed, but sometimes the staff goes beyond that by beginning treatment. Necessary resources, staff, and beds are used on a patient who should be discharging to go to their private doctor or who should be transferred to another department. The hospital needs to reinforce the mission and objective of the ER. Overall challenges. Economics. Long waits are causing for Saintemarie University Hospital to lose money. In an average year, roughly 3% of Saintemarie University Hospital patients will leave before being treated because of long waits. This has a tremendous impact on the hospital's bottom line. In August 2011, the Wall Street Journal reported revenue of about $450,000 is lost if even 1% of patients walk out of an emergency department with an annual volume of 50,000 patients. Saintemarie University Hospital is currently at 3%. In addition, long waits increase overtime for nurse and administration staff. Due to the overwhelming demand, there are times when staff have to stay beyond their allotted shift times in order to help with patients. Overtime is at a record high. Also, some patients need to be treated within a certain time frame, and if they are not, it can lead to serious consequences for their health. This can put the hospital at risk for lawsuits and malpractice if patients are not being treated within that time frame. Controllable economic variables include salary, wages, and supplies. Uncontrollable economic variables include increased cost of healthcare and the ability to deny patients. Quality control. The delay in care has decreased the quality of care of patients to the point where an outside agency has intervened. Management has reported that 1/3 of Degree 1 patients are not being seen within their maximum delay period. Poor quality has a serious impact on a patient's health and recovery time. Studies show that patients who are delayed in care end up having longer lengths of stay compared to patients who are treated immediately. Low employee morale. The burden of delayed patient care is also felt by the employees of the hospital. The morale is low due to them being overworked and facing pressure to meet the needs of patients. In recent months, doctors and nurses have resigned from their job. Low morale has a huge impact on customer service. Recommended solutions. Invest money into the hospital, increase staff. To improve the process, the hospital should invest the money into expanding staff during those critical hours of 9 a.m. to 7 p.m. If the hospital can keep the backup from occurring during those hours, then it can reduce the long waits throughout the rest of the day. Seek out the doctors and nurses who resign. Experienced nurses resign, and that is unfortunate because they are difficult to replace. Currently, there is a shortage of nurses in the industry, and the hospital does not want to lose valuable assets. Also, the hospital should contact the young doctors who left the emergency room department. In the next coming years, there will be a shortage of physicians. It is important for the hospital to retain young talent because soon the healthcare industry will be lacking in it. Hire a new head of ER. Managerial and operational knowledge are needed for a hospital to run smoothly and efficiently. Currently, the initial waiting stage to the discharge stage, there are processes that need to be changed to reduce the patient time within the ER. A new CT scanner procedure should be implemented. There is nothing dramatic that must be changed. The staff should implement the new policy discussed above to reduce unused time for the machine. Also, a memo can be sent out before the end of the month reminding staff of the ER's objectives. Upper management needs to reinforce that patients need to move to the final stage once they are stable and have a diagnosis. Conclusion. Saintemarie University Hospital's economic well-being is being harmed due to the loss of revenue and increased liability by the long waits. This is something that must be addressed immediately.